Excellent, Dr. Akshay. Okay, role of beta 3 agonists in activating the brown adipose tissue.
Yeah, so beta 3 agonists will cause increased activity of the thyroid hormone in the brown cells as well, which in turn will lead to increased energy expenditure. So that is one of the mechanisms that some of these medications are looking at, selective thyroid hormone activation only in the adipose tissue.
Right. Thank you.
Yes,
Yes.
it does indeed. Yes, and as Sir pointed out, exercise will lead from hypertrophy to hyperplasia, which is also a good effect because it reduces the
Yes.
inflammatory markers in the adipose tissue.
Exercise will cause release of irisin, which
Yeah.
will convert the white fat into the brown
Brown
fat.
tissue, exactly.
Right. Thank you.
Nowadays, last question.
Yes.
Nowadays, there is so much of hype of ice baths and all, which is conducted, and it's trending so much. So, what is your take on that?
Yeah, so for the kind of cold exposure we need for converting brown tissue into when converting white into brown tissue, it has to be excess cold exposure for a prolonged period of time. So at least from a adipose tissue perspective, I think it's all hype. I don't see any potential benefit there.
Right.
Just to add to that, I was recently at the ICO in Brazil, and there was somebody who is doing the shivering protocol. So they have a protocol. The important part is you need to shiver. So they have come up with protocols, putting them in for 10 minutes, 12 minutes, and so on. But the results so far, based on how much brown adipose tissue is activated, is negative. So there are human studies now, as you mentioned as well. So, but it is interesting, and yes, it's trending everywhere for sure.
Thank you.
Right. Thank you. Okay. Thanks. Thanks. Okay. Good. Now, may I invite Dr. Prakash Keswani. He'll speak on the cardiometabolic benefit of intermittent fasting, which is in vogue these days. Dr. Prakash is Senior Professor Medicine and Endocrinology from SMS Medical College, Jaipur. He is the President and faculty selection board of many important organizations, has many publications, and has organized many successful conferences. Dr. Prakash.
Thank you, sir, for your kind words. At the outset, I shall like to thank the organizers for giving me this opportunity to be with you all in this evening. In this part of today's session, we shall be discussing certain important aspects about cardiometabolic benefits of intermittent fasting in diabetic and obese population. I am thankful to my previous speaker, Dr. Ashish, and for showing the importance of the adipose tissue, which can cause various other harms, and how can it be reduced. There is a strong association between the diabetes, obesity, and cardiovascular disease. Around 86% of the diabetic patients have been found to be overweight or obese, while around 50% of the deaths related to the type 2 diabetes are due to cardiovascular disease, and more than two-third deaths related to high BMI are due to cardiovascular disease. And there's an intermediating role of insulin resistance and metabolic syndrome in cardiometabolic based chronic disease. It has already been highlighted also. And when we talk of cardiometabolic based chronic disease, adiposity and dysglycemia are the metabolic drivers. With increase of 1 unit of BMI, there's 5 to 7% increase in the rate of heart failure and 6% increase risk of hemorrhagic stroke. And with increase of 10 kg body weight, there's 12% increase risk of the coronary artery disease. So we see that excess fat how can cause a high degree of cardiovascular risk, and with the reduction of 5 to 10% of the weight, we can significantly reduce the risk of type 2 diabetes and the cardiovascular risk. So for this, what we have to do, again, the important thing is to reduce the weight. For that, again, we have to rely mainly on the diet. And intermittent for a very long time, continuous energy restriction is being used for the reduction of the weight. In last 1 decade, there is a number of studies which suggest that intermittent fasting is an equally good way of reducing the weight, and it has potential advantages that it reduces weight and improves metabolic parameters. It improves insulin sensitivity, blood pressure, lipids, and inflammatory markers also. Intermittent fasting is consuming very little or no calories for time periods ranging from 12 hours to several days with a regular pattern. This can be alternative fasting, periodic fasting in the form of 4:3 or 5:2 intermittent fasting, or time restricted feeding, where we take food for around 6 or 8 or 10 hours a day and remain fast for the rest of the period of the day. Although calorie restriction is beneficial, there is significant difficulty in sustaining daily calorie restriction for extended periods of the time. And intermittent fasting has higher compliance and has shown promise in the improvement of metabolic risk factors, body composition, and weight loss in obese patients. So it is easier to follow the intermittent fasting for a longer periods, and it has been found to improve many metabolic abnormalities which are associated with the obesity. Intermittent fasting has same or less negative effects on metabolism compared to the traditional calorie restriction. And it has been found that intermittent fasting causes less loss of lean body mass. With the fasting, there's loss of the lean body mass also, reduction of the protein also. But intermittent fasting is associated with the greater loss of the fat and lesser loss of the protein or lean body mass. It has been found to hypothesize to be work on the basis of gut microbiome, circadian rhythm, and modifiable lifestyle behaviors. Circadian rhythm have an impact on metabolism across the day. The meals consumed during night are associated with greater PP glucose and insulin exposure than during the day, leading to increased HbA1c and risk of diabetes over time. In fasting, particularly time restricted eating actively imposes a diurnal rhythm of food intake aligned with 24-hour light dark cycles, and that it helps in improving the molecular mechanism of various metabolic abnormalities. Intermittent fasting has also been shown to not only to reduce the weight, but at the same time has been found to improve various metabolic and inflammatory pathways also, and that turns in the benefit of the decreasing of the cardiovascular risk. So intermittent fasting has been found to be associated with the alteration in the weight and body composition, more of the fat loss, less of the protein loss, and also has beneficial effects on the glucose metabolism and insulin sensitivity, and helps in a number of tissues like liver, blood vessels, and adipose tissue. And there is a big number of clinical evidences for it, and these studies show that fasting for around 12 months was found to have associated with the weight loss along with the reduction in the HbA1c also. This again a important RCT which suggests that intermittent fasting reduces the weight like not as good as that of the continuous energy restriction, but it has also been found to reduce the various metabolic abnormalities which are associated with the cardiovascular risk also. This RCT, this system